to increase.
Okay, fine. Like, am I audible? Like, is it
Yeah,
fine now?
you're okay. Okay. Now
Okay, fine.
you need to just maybe speak a little on the higher note.
Okay, fine.
Yeah. So let me introduce. So we have with us Dr. Yadukrishna, who has secured a rank of 184 in the recent NEET-SS surgical group exam. So hi Yadukrishna.
Thank you.
So let's start with how does it feel?
Uh, Excited first and foremost. Very happy now. Uh, Elated. What else to say now? Like very much excited. Getting this rank 184. Could get into my dream branch. That is my main.
Yeah. So what is your dream branch?
Like I'm planning to take MCH vascular.
Vascular surgery.
Yeah, just MCH vascular.
Okay. Which institute are you looking at?
Jayadeva, Bangalore.
They were Bangalore.
Yeah.
Okay. And was this your first attempt?
Like sir, after my SRship, like I have 1 year bond. Like SRship is being completed. Yeah, this is my first attempt.
Okay. Did you give the exam in March or you did not?
No, this is the first attempt, sir.
Okay. Okay. So you prepared along with SRship.
Yes, sir. I prepared along with SRship.
So when did you start preparing for your NEET-SS?
So to be honest, sir, like I started preparing like around last 4 months only. Like the SRship was pretty much little work was it. Like it was hectic. So I could only prepare for the last 4 months. So before that itself, I had like initially I had prepared little bit during my second year. So then third year also I prepared like, but for the last 4 years I was consistently preparing for the
Okay. Where do you come from originally?
like I'm from Kerala, sir. Like now currently I'm doing my residency in GMC Kozhikode, Government Medical College Kozhikode, Kerala.
Okay. 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 Correct. Correct. So during your residency and otherwise, and so which books have you particularly followed? Sabiston, Schwartz, or Bailey?
Sir, to be honest, sir, during my UG time itself, I've just gone through Bailey a little bit. Then in my PG first year, I couldn't concentrate much. Like there was like ward works and also patient, like we were managing patients, and then it was a little bit hectic. Like so, during my second year, I was into this QC and stuff. So basically, at that time, I went through Bailey again, like almost all the figures as well as tables, and also Swabiston for GI part. Mainly it was Bailey, sir. Bailey figures as well as table. Because also QCing and all for purpose for the sake, I had to go through all the tables as well as images.
Okay. So what do you think in the exam? What was it? You were relating it to Bailey or Sabiston or your clinical acumen? What were you relating it? If we ask particularly in these three things.
So I think, sir, most of the question was from Bailey, I guess, sir. Bailey, some question like decor and all straight away point from Bailey, sir. Like some question came from Bailey, and also some from my clinical acumen also. But the cardiovascular part was little bit tough for me. Like I couldn't attempt much from the cardiovascular part. Then neurosurgery, this imaging part, like from this clinical equipment from the emergency department, like while working in the casualty, I was like could manage that. But the cardiovascular part, like I couldn't like pretty much attempt most of the questions. It was a little bit tough for me. I don't know about the rest. Like for me, it was a little bit tough.
Okay. So you have a cardiovascular CVTS rotation at your college during your
Uh,
residency.
we do have, sir. During our second year, we have specialty postings. So at that time, we had cardiovascular residency rotation was there, but since at that time the exposure to the specialty was we were like since we are after this COVID batch, so the time period for us was only 6 months. So only 2 weeks only we could attempt for the CVTS part. So that much exposure to the CVTS was not there.
And I think the part of CVTS in Sabiston is very long, but in Bailey it is relatively brief.
Yeah, yes, sir.
So,
Sabiston, sir, I couldn't go through the CTVS part. Sir. Like only GI part I went to Sabiston, but Bailey I could manage. Like Bailey I could manage a little bit, sir, because of for QCing purpose and all, like SECON and all. For the QC I went, so at that time I have to go through all these things.
okay. So how many hours a day you were reading in the last 4 months when you started preparing seriously?
Seriously, sir, like I had works, like I had CMO duties and other work also during the same time. So I could like during the last 2-3 weeks, I could like prepare for like around 6 to 8 hours. Before that, I could only prepare for like 4 or 5 hours at max. I can only do that, sir. Like it was like finding it a little bit hectic, sir, like with the duties and stuff. So,
Okay.
and also workloads.
Yeah, I can understand. Of course, it is managing both the things and then having
Yeah,
that concentration, thinking about the patients also. So it can be
yes,
get
sir.
it can get hectic. So what was your style of preparation? Whether you were a textbook reader or a video watcher or a MCU solver, how did you approach it?
Sir, actually, my focus was more on questions, sir. Like I went through the questions lot. I went through a lot of questions, and then with that questions, I was retrospectively making notes and no studying. I was concentrating like that. Like I prepared notes, and I was already having a pre-made notes with me based on this Bailey. Bailey, I was having a pre-made notes, which I even used for my university exams. So much of the concentration was on that, and also with the and doing most of the questions. Solving question was GT and doing question was my main. Like for the last 4 months, I was doing a lot of questions as well as GTs.
Okay, so when we talk about questions, you mean going through the question banks or giving small tests? What was your
So,
style? Like solving a question, immediately getting the answer, like in the question bank format, and reading the explanation and going to next question,
yeah,
or
I was
solving
doing like
50 questions at a stretch and then going through the explanations at a stretch?
sir, actually, I was doing the first one, sir. Like I was taking a question, I was just looking the answer. Uh, After 50 questions, sometime I won't be getting the time. So what I was doing is I will be just going through a question, would be looking the answers, and then detailed explanation of the answer. That's what I was doing, sir.
So
And
the
I was
reverse
also
reading
preparing,
pattern.
yeah, review pattern,
Okay. And
not
then you
exam
need
pattern.
to you used to go back to the textbook and read again that question, or was it
Uh,
you were completely dependent on the explanation?
Uh, Sir, actually, if at all I was having some doubt regarding the same, I would be going back and would be referring that topic. But most of them would be having detailed explanation, so I was relying on that, and also I was getting an idea about what all to look for, like in a concise way. Like I was getting this topics were being repeated, like that I was getting an idea about what to focus on, and that was advantage of doing questions. In the case of GT, I was giving like a proper test format only. I was giving the GTs, like reviewing the answers after doing the GT.
Okay, so how frequently did you used to give GTs?
Sir,
How
frequently.
frequently? Hmm.
Sir, in total, I gave like around 12 or something. Sir. Only that much I given during the 4 months period. I was giving 12 or some 12 max 12 around that. Only I guess 12, 10, 12. I guess. Sir.
Okay, and how much did you used to review them? Like, yeah, so supposedly you finished the GT. So 150 questions can take like some of them review it for 2 3 days. Some of them fix a fixed time period that in these 3 hours I'm going to review whatever errors are there. So what was your style?
Sir, I couldn't like complete it during like I couldn't get a complete stretch. I was doing it in like 2 3 days only, sir. So that's why I could only solve only 10 to 12. Like for the past 4 months, only 10 to 12 could be solved. Like it was taking time consuming, sir. And also, I was not getting a continuous touch to study. I was not taking leave from my work. Like I was doing it with the SRship, sir.
So you never took leave up till the day of exam, or
No, sir.
not even a single day or a week?
I was like last week. I was given some week off by a unit chief. So only OP I attended, but the remaining he gave some relaxation.
Then that's a remarkable achievement.
Yeah,
With
yeah, yeah. No,
along with
also, like, I
everything
should
and then
commend my
managing.
HOD for giving me like 1 week off, like for this like last 1 week. Only OP I could like, but remaining OT and other things, he just gave me a relaxation a little bit.
Are you still working?
Ah, yes, sir. Still working, sir.
So after the day of exam, next day you joined back.
Okay, yes, sir. Saturday it was like Monday itself, he joined back, sir. Like Monday
Yeah,
was
so
over OP.
I can understand the scenario, like working and practicing. Then of course, then MCQs are very handy. You can solve them on the
Yes,
go.
anywhere, yeah. And also like it was like in this app like it was like image based, Bailey based. It was having some division like that, so it was easy for me. Like images and I was focusing, and that flashcard was really useful.
Okay.
That was really nice. The trials part and all, I was finding it very useful. But questions, but I found it very useful. Questions regarding trial was even limited, but it was still useful.
It at least gives you that satisfaction that okay, this
Yeah,
part is also covered in case
covered.
it comes
Yes,
in
that's what.
exam.
Yeah.
But you don't know how the real exam is going to be.
Yes, of
But
course. Like it could change every pattern could change every year. Now. So like anyway, we'll have to go through the trials, and that flashcard was really handy. Like I could go through all those things. Flashcards were really nice stuff.
Okay, so those flashcards, were you able to recall the flashcards based, or were they helpful in eliminating? Did you find that, okay, I had read that somewhere in the flashcards or something like
Actually,
that?
sir, I've not gone through the recall. I've not gone through any recall after the exam.
No,
I
no,
just
during the
after this
exam I'm
exam,
talking. During the
during the
exam,
exam,
during the exam.
during during the exam, sir. Actually, to be honest, sir, I was not able. Like, I couldn't comprehend it properly. Like, I was in that flow. I was going on through all the questions. Like, I didn't even know from where the questions came. I didn't even go through the recalls also. So it came automatically. But these questions, I think these questions helped me a lot. As well as this flashcard, I think it helped me a lot. Like from my mind, I could say like, okay, most of the questions came or something like that.
Okay, okay. So how did you come to know about STEM?
Through my friends, one of my friend has taken STEMS app, so he also secured a good rank. Like he also got a good rank, so he recommended me this, and like we four people took the app at that time.
Okay, who exactly?
It was my senior, Dr. Akshay, scored a rank of 230, and also me and my friend, Dr. Suraj, he also secured 450 rank.
Okay, Dr. Suraj 450.
450. Yeah, we all three are planning to take MCH vascular
Okay,
itself.
all three are planning to take MCH basket.
Yeah, yeah.
I think Dr. Akshay got a rank, even in, rank 2 in INISS, right?
INISS, yes, yes.
Okay, okay. So he is also
He was my
planning.
he was my immediate senior, so
Okay,
I used to ask him a lot of advices regarding what to do, like and all like advices from him. So he recommended the app to me, like STEMS is an app. It has got a good question pattern, like it's like they got different segments like image based, daily based, shorts based, so very helpful for you. So then me and my friend Suraj took the app.
okay, great. So how did you eventually? What all were you able to? You already told flashcards. You
Yeah.
already told the different questions. Yeah. What else did you find helpful?
Then sometime when I'm in the OT, I will be doing that custom module. That was helpful. Like we can give the number and then number of questions on the topic, and then I was doing the custom modules. That was also helpful, sir. Then what I concentrated more was on questions as well as my homemade notes, because since I was having an hectic schedule, I couldn't go through all them. I concentrated also on the Bailey images as well as tables. I was having a separate PDF of this Bailey images as well as table, just the tables as well as images. So 2000 something was it, like I was covering like around fixed amount of questions, like fixed amount of figures as well as tables from the same.
Okay. What was your last week strategy?
Last month strategies I was
Last week.
depending on my
Last week.
last week strategy. Last week strategy was like more on revision, sir. Revising the pre-made notes as well as some questions I have like uh, uh, some questions I also mentioned written in the note to cover this in the last. So I bookmarked some of the questions and selected topics. I also went through that.
Okay. And so as you talk about
Also,
the notes.
last week I did one GT. That was also it was written in the group like some one GT was easier. So not to go through some specific GTs, go through this GT. So attended that.
Great. So you keep on mentioning about the notes. So
Yeah.
can you elaborate more on the notes of how did you make those notes and how those were helpful, particularly for other people who might be watching this. How many pages of notes were there? Whether they were 100 pages, 50 pages. What information did you use to write?
So
How did they help you?
sir, actually, sir, when I did my UG time itself, I did from AIMS, sir. So we had surgery like we had to read from Bailey itself. So I was having a note at that time, but it was not elaborate. So I had an idea how to make the notes. Like we had BT, they will be marking, our seniors would be marking what all are the important topics at that UG time. We were reading that. Then when it came to my second year itself, during the specialty itself, I just started making the notes from selected what all important topics for the for our university. So we are covering most of the topics from that. Then whenever I'm solving some questions, I will be adding some extra MCQ points into these notes. So because since I was having only four months or something to prepare, so what I did was I wanted to revise more because I had problem with this memory thing. So I'm not sure like if I'm reading more, sometime it won't work for me. What I used to do is I just for me memory is a limiting factor. So what I do is I do more revisions and also questions. Only these things stay in my mind. So I was doing like that and images and figures. So whenever I'm doing a question, if at all the topic is there, I will be marking it out. And if at all extra points, I will be marking in my note. And that was my strategy, and I will be highlighting it. So questions and this note, I was adding on with this questions, I was adding to my notes exactly. Like doing the questions, I was adding that to the notes.
Okay. So when are now you leaving your job and taking a break of some days before you join your dream branch in
Sir,
NC?
actually, sir, we have a bond of like 1 year.
Okay.
It's actually being, it will only get completed by April 4th. So basically, we can cut the bond. It's not like it's necessary, compulsory to do it. Anyway, the NEET counseling will be like, counseling and the joining would be earlier than that, before that, anyways, March or May, February, I'm not sure. So like, then after that, after joining, I'll again come back and do this bond.
Remaining 2 or 3 months.
Yeah, remaining 1 month, most probably 1.5 month.
Okay. So now we'll finally end with you giving, I will give you the open chance of what do you want to tell to anyone who is preparing for next year. What should they aim for? Because a lot of people, a lot of students, they first decide the branch, then they decide the college, then they start working. And some of them just they focus on first getting a rank and then thinking about the specialty. What is your advice on that?
For me, it's a branch came first to me. Like, branch was already decided. Like for me, it was from my second year or so. It was decided. Like I was planning to take this branch from my second year itself. And I was fortunate to work under a vascular surgeon here in my first year itself. So he was like a mentor to me, Dr. Chandrasekhar sir. So I was working under him. So I got inspired from him. So for me, the branch came first. Like I would do the MCH vascular itself, either from Jaydev or like or Vellore, CMC Vellore. This was my plan. um, then I was working. I just went by the trends and I was just working. Like, uh, everyone's strategy would be different, sir. Like it depends on their working environment and family. Lot of issues would come when we are working for the. I mean, for this NEET-SS anyway, all those factors would come. For me, it was work. So for someone, it would be family. Lot of pressure. Everything would be there. So strategy, I guess, it would be different for everyone. Like my strategy was, for me, the branch came first, and then I was working for that. Like I wanted to get a good rank. That was first thing. Like anyway, whatever be a branch, we want a good rank to achieve it. Like that so I that was the strategy, sir. Nothing like branch came first.
Okay. So you decide the branch, but then when during the exam you first focus on getting a rank.
Yeah, that's
You
what.
get a good rank, so all options are open, and then you can
Yeah,
choose
that's
the
what.
best branch that you want, right?
Yes. Uh, make our options like we should like anyway we should aim for a good rank. Without a motive, if we're setting our bar low, it would be a problem. We should always keep a bar high, like set the bar high and then work for that. That is the main thing. Like remaining, we can think later on. That's what like. But branch for me, it came like in secondary itself, sir. We were all like even Akshay sir was also working in the same under this Chandrasekhar sir. So Suraj also there. Like we were all inspired from Dr. Chandrasekhar sir. It seems.
Okay. Great, great, great. Congratulations.
Thank you,
And
sir.
have the most of this time. Enjoy this moment because
Yeah,
this
definitely.
moment, I think, might be the last competitive exam result of your life. And this
Okay.
rank will stay with you because I
Hearing
remember
this,
the time when I got a rank in NEET-SS and then I took the admission. That kind of high never comes again in
yeah,
life.
yeah,
Of course, different
yes,
kinds of highs will come, different kinds
yeah,
of moments will come, but this moment will never come.
yes. That's the point, sir. At different levels, we as a doctor would be writing different exams, and every time we get a good rank, it's a high, sir. Like, I think we are addicted to this high. That's why we are writing more and more exam, it seems.
Now it is done. Now there are no more exams. Only the exam that you
Oh,
pass. Maybe.
hopefully, maybe later on something. Not sure. No idea. Don't know where the path leads to.
Correct, correct. No, all the best, and I'm
Thank you, sir.
sure you will become a very good vascular surgeon. Please stay in touch,
Yes, sir.
and
Definitely, sir.
do let me know where you get admission.
Sure, sir. Sure,
And
sir.
all the best for the future. Thank you so
Thanks,
much.
sir.
Thank you so much for your time.
Thanks a lot, sir.
Thank
Okay,
you.
sir. Bye,
Thank you.
sir.
Bye.